I want you to try something right now, before this video reaches 90 seconds. Sit upright in your chair. Place both feet flat on the floor. Put one hand on your chest and one hand on your abdomen, just below your navel. Now breathe in through your nose for 4 counts. Slowly. The hand on your abdomen should rise. The hand on your chest should barely move. Hold for 1 count at the top. Then exhale through your mouth for 6 counts, completely, until you feel the abdomen fall. Do that 3 times right now, 3 cycles, 12 seconds each, 36 seconds total. If you did that correctly, your heart rate just slowed. The muscles around your blood vessels just relaxed slightly. And the chemical environment inside your arteries shifted in a direction that, if sustained for 5 minutes, produces a measurable reduction in blood pressure that has been documented in peer-reviewed clinical trials. What you just did is not relaxation. It is a targeted activation of a specific branch of your nervous system that directly governs vascular resistance and heart rate. And a version of this practice has been used systematically in Japanese clinical and preventive medicine for decades under a protocol I am going to explain to you completely today. I am Dr. David Miller. I have been practicing medicine for 15 years, and I built this channel on one principle. There are interventions with genuine clinical evidence behind them that require no prescription, no clinic visit, and no cost, that most patients are never told about because the system that manages their health does not generate revenue from teaching them. This is one of the most evidence-supported of those interventions. Subscribe to Dr. Miller right now and hit that like button. We are building a community of people who take their physiology into their own hands instead of waiting for a prescription to do it for them. Every subscriber makes this channel more visible to the next person who needs it. Before I explain the specific protocol, I want to tell you about a patient I will call Kenji. He was 63 years old, a retired engineer, precise and methodical by temperament. He came to see me with blood pressure readings that had been sitting between 148 and 158 systolic for 2 years. He was not on medication. He had resisted it because he had watched his father manage hypertension with pills for 30 years, adding one medication after another, and he had decided that if there was any other path, he wanted to find it first. He had tried dietary changes. He had reduced sodium. He had started walking 30 minutes a day. His readings had improved slightly from the low 160s to the high 140s, but had plateaued. He came to me not expecting a dramatic answer. He came because he was running out of time to find a non-pharmacological option before the numbers forced his hand. When I explained what I was going to teach him that day, he was skeptical in exactly the way a trained engineer is skeptical. He wanted the mechanism. He did not want to be told to relax and breathe. He wanted to know what was actually happening physiologically. So I explained it to him the way I am going to explain it to you now, because the mechanism is what turns a breathing exercise from something that sounds optional into something that feels as necessary as a medication. Your blood pressure is governed at every moment by the balance between 2 branches of your autonomic nervous system. Autonomic simply means the part of your nervous system that operates below conscious awareness, managing your heart rate, your breathing rate, your digestion, your vascular tone, and dozens of other functions continuously without you having to think about them. The 2 branches are the sympathetic system, which activates during stress, perceived threat, exertion, and arousal, and increases heart rate, constricts blood vessels, and raises blood pressure. And the parasympathetic system, which activates during rest, safety, and recovery, and decreases heart rate, dilates blood vessels, and lowers blood pressure. In a healthy young person, these 2 systems are roughly balanced across the day, with the sympathetic dominant during activity and the parasympathetic dominant during rest. In people with chronic hypertension, and particularly in people over 60 who have lived with chronic stress, poor sleep, and sedentary patterns for years, this balance has shifted. The sympathetic system is chronically overactivated. It never fully releases. Even during rest, even during sleep, the vascular tone remains elevated, the heart rate remains slightly elevated, and the blood pressure remains elevated because the nervous system has recalibrated its baseline to a higher level of activation. The pharmaceutical approach to hypertension works largely by blocking the downstream effects of this sympathetic overactivation, reducing heart rate with beta blockers, or relaxing vessel walls with calcium channel blockers or ACE inhibitors. But none of those medications address the overactivation itself. They manage its consequences while the cause continues. The breathing protocol I am about to describe addresses the cause directly. It does so by activating the parasympathetic system through the most powerful and most accessible parasympathetic activation pathway available to conscious voluntary control. The vagus nerve. The vagus nerve is the primary nerve of the parasympathetic system. It runs from the brainstem down through the neck, through the chest, and into the abdomen, branching to the heart, the lungs, the digestive system, and numerous other organs along the way. It is the highway through which the parasympathetic signal travels from the brain to the cardiovascular system. When the vagus nerve is activated, it releases acetylcholine at the heart, which directly slows the heart rate. It releases signals to the smooth muscle of the blood vessel walls that cause them to relax and dilate, and it suppresses the activity of the sympathetic system through inhibitory pathways in the brainstem. The result of vagal activation is a coordinated cardiovascular shift toward lower heart rate, lower vascular resistance, and lower blood pressure. The question is how to activate the vagus nerve deliberately, on demand, in a way that is strong enough to produce a clinically meaningful blood pressure reduction. And the answer, the one that has the strongest evidence base and the most direct clinical validation, is slow, deep, diaphragmatic breathing at a specific rate. Here is the physiology. Every time you inhale, the diaphragm descends and the lungs expand. This expansion stimulates stretch receptors in the lung tissue that send signals via the vagus nerve to the brainstem. These signals temporarily increase heart rate slightly during the inhalation phase, a phenomenon called respiratory sinus arrhythmia. Every time you exhale, the lungs recoil and the diaphragm rises. The stretch receptor signal decreases. The vagus nerve releases its inhibitory signal on the heart. Heart rate slows during exhalation. This cycle of slight acceleration during inhalation and slowing during exhalation is the normal respiratory sinus arrhythmia that happens with every breath. It is a sign of a healthy, responsive vagus nerve. When breathing is slow and deep, this cycle becomes amplified. The diaphragmatic stretch is greater, the lung expansion is greater, the stretch receptor signal is stronger, the vagal response is more robust, and crucially, when the exhalation is longer than the inhalation, the slowing phase dominates over the acceleration phase, and the net effect on heart rate and vascular tone is a shift toward parasympathetic dominance. Extended exhalation is the key variable. It is why the protocol uses a shorter inhale and a longer exhale, always. Subscribe to Dr. Miller and hit the like button. The respiratory sinus arrhythmia mechanism and the role of slow diaphragmatic breathing in vagal activation is established autonomic neuroscience. It is taught in cardiology and anesthesiology training. The specific application of this mechanism to blood pressure management as a standalone clinical protocol has been documented in research from Japan's National Cardiovascular Center and validated in multiple independent trials since. This channel exists to bring that evidence to the people who need it. Hit subscribe. It means the next person with this question finds the answer. Now I want to explain the specific protocol, which is called slow deep breathing or device-guided slow breathing in the clinical literature and which has been refined in Japanese preventive cardiology practice into a precise 5-minute intervention with a documented average systolic blood pressure reduction of 8 to 10 millimeters of mercury in people with stage 1 or stage 2 hypertension. That reduction, achieved with breathing alone and no medication, is comparable to the effect of starting a low-dose antihypertensive drug. The protocol has 3 components: the breathing rate, the ratio of inhalation to exhalation, and the body position. The breathing rate is 6 breaths per minute. This specific rate, not 5 and not 7, but approximately 6, is the rate at which breathing entrains the cardiovascular system into a state called cardiac coherence. At 6 breaths per minute, the respiratory cycle aligns with the natural oscillation frequency of the baroreflex, which is the reflex arc in the brainstem that continuously adjusts heart rate and vascular tone in response to blood pressure changes. When breathing entrains with the baroreflex at this frequency, the two systems begin to resonate. The baroreflex sensitivity increases, meaning the system becomes more responsive to blood pressure fluctuations and corrects them more effectively. Heart rate variability increases, which is a direct marker of parasympathetic tone and cardiovascular health. And blood pressure falls, not as a transient effect, but as a sustained consequence of improved autonomic regulation. 6 breaths per minute means each breath cycle takes 10 seconds. The ratio of inhalation to exhalation determines how those 10 seconds are divided. The evidence supports a ratio that allocates less time to inhalation than to exhalation. The Japanese clinical protocol uses a 4-count inhale and a 6-count exhale, giving a 10-second cycle at a comfortable pace. Some practitioners use a 5-count inhale and a 5-count exhale when beginning because the extended exhale can feel uncomfortable to people who have been breathing shallowly for years and whose diaphragm is underactivated. The 4-6 ratio is the target. The 5-5 ratio is a reasonable starting point for people who need to build diaphragmatic capacity before reaching it. The body position for maximum effect is seated upright with both feet flat on the floor and the spine erect but not strained. The upright position allows the diaphragm to descend fully without compression from the abdominal organs, which happens when you are slumped or reclined. The full diaphragmatic descent is what produces the strong lung expansion and the robust stretch receptor signal that drives the vagal response. If you practice this lying down, you will still benefit. But the seated upright position with active posture produces the strongest effect. The hand placement I described at the start of this video is not incidental, it is a biofeedback mechanism. Your hand on your abdomen confirms that the diaphragm is doing the work. Your hand on your chest confirms that the accessory breathing muscles in the chest and neck are not substituting for the diaphragm. This matters because the majority of adults with chronic stress breathe predominantly with the chest and neck muscles, a pattern called apical breathing, and have largely lost the habit of diaphragmatic breathing. Apical breathing produces a shallow, fast breathing pattern that stimulates sympathetic activity. It is the opposite of what we are trying to achieve. The hand placement makes the correct pattern tangible and verifiable. The duration is 5 minutes, performed twice daily. Once in the morning within the first 30 minutes of waking, before the sympathetic activation of the day's first stressors has had time to establish the day's pressure baseline. And once in the evening, approximately 45 minutes to 1 hour before sleep, which both lowers the blood pressure going into sleep and improves sleep architecture by activating the parasympathetic state that supports sleep onset. If you can only do one session, the morning session has the greatest impact on the day's average blood pressure. If you can do neither consistently, even 3 minutes of slow breathing at the moment you feel stress beginning to rise provides a meaningful acute reduction in sympathetic tone. The device-guided breathing tools, small electronic devices that produce a visual or auditory guide for breathing at 6 breaths per minute, have been studied in randomized controlled trials and shown to produce blood pressure reductions that are sustained over months of consistent use. The device is not necessary. A phone timer, a slow metronome application, or simply counting in your head works equally well. The device merely makes the rate easier to maintain for people who are new to the practice. Now I want to tell you what Kenji experienced, because his response illustrates both the speed of the acute effect and the timeline for the sustained effect that matters for clinical blood pressure management. In the session where I first taught him the protocol, I measured his blood pressure before and 5 minutes after a single session of slow diaphragmatic breathing. Before the session, his systolic was 152. After 5 minutes of correct practice, his systolic was 141, 11 points. In 5 minutes, without a pill, without a device, without anything other than the deliberate recruitment of his own parasympathetic nervous system. He looked at the cuff reading with the expression of a man whose model of the world had just been revised. He asked me why nobody had told him this before. I told him what I tell everyone who asks that question. Because there is no revenue in a breathing technique. Because a 5-minute practice that reduces blood pressure by 10 points is not a billable procedure and does not generate a prescription renewal. That is not a conspiracy. It is simply the structural reality of how clinical care is organized and what gets communicated in the 12 minutes available. Kenji practiced twice daily for 8 weeks. At his follow-up, his average home blood pressure readings across the previous 2 weeks were 134 systolic. He had gone from 148 to 158 at our first appointment to a consistent 134, without medication, without any additional dietary changes beyond what he had already made. The breathing protocol alone, practiced consistently twice daily, had moved him out of the stage 2 hypertension range and into a level that his previous cardiologist would have considered a successful pharmacological result. He told me the practice had also changed the quality of his mornings in ways that were difficult to quantify but unmistakable. He was waking less tense. He was moving through the first hour of the day with less of the background urgency that he had assumed was simply his personality. It was not his personality. It was his chronically overactivated sympathetic nervous system finally being given a consistent daily opportunity to release. How old are you? Write it in the comments right now. I want to know the age range of this audience because it determines what I focus on next. If most of you are in your 60s, I want to address the research on combining slow breathing with dietary nitrate intake, specifically the synergistic effect on endothelial nitric oxide production that produces blood pressure reductions greater than either intervention alone. If many of you are in your 70s, I want to discuss what the evidence shows about baroreflex sensitivity restoration at that age, because the responsiveness of the system to this intervention changes with age, and the modified protocol for older adults is worth a dedicated discussion. Your blood pressure is not simply a number your genetics determined. It is the real-time output of an autonomic nervous system whose balance you have more direct access to than any medication gives you. The sympathetic overactivation that is driving your readings upward did not develop overnight. It developed over years of stress, poor sleep, shallow breathing, and a nervous system that was never given a consistent daily practice of deliberate release. 5 minutes in the morning, 5 minutes in the evening, diaphragm leading, 4 counts in, 6 counts out, 6 cycles per minute. That is the intervention. The biology is waiting for you to use it. I am Dr. David Miller, and I have spent 15 years watching patients add medications to medication lists, while the physiological tool that could reduce their need for those medications sat unused because nobody had explained what it was or how to use it. The vagus nerve is not alternative medicine, it is anatomy. Slow breathing is not wellness advice. It is applied autonomic neuroscience. Subscribe to Dr. Miller. Hit the like button. Share this with someone whose blood pressure is being managed with pills and who has never been told that their own nervous system, trained correctly, is capable of producing a result the pills are supposed to achieve. The healthcare system profits from prescriptions written indefinitely. I profit from you needing fewer of them. Subscribe if that difference matters to you. This content is educational in nature and does not constitute personalized medical advice. If you have hypertension and are currently on blood pressure medication, do not stop or reduce your medication without speaking to your physician. As your blood pressure improves with consistent practice, medication adjustment should be made in partnership with a qualified healthcare provider who can monitor your response appropriately.